Hello everyone, I'm Vin Ebanu here at the Emergency Department at Ocean Medical Center with Dr. Brad Pulver, where we're going to be discussing some of the things that go on inside the emergency department at a hospital, when to go, when not to go for treatment of an issue, the response time of doctors and nurses, and a little bit more. Dr. Pulver, people go to the ER for a lot of different reasons, certainly for some of the trauma things like a heart attack, or if they're feeling symptoms, or if there's some sort of severe injury with a lot of blood. But there are other times where people just kind of come to the ER, maybe if their PCP is not open or something like that. So what are some of the things that people should be going to the ER for, and some things that they should either see their primary care physician for or go to an urgent care?
Well, certainly severity of illness is important. If you really feel like you're in trouble, if you feel like you're dying, very sick, then you should not only come to the emergency department, but you should call 911 and get here emergently with paramedics or medics who are trained to do some potentially life-saving pre-hospital treatment.
What are some of the symptoms? Because I think people, if they're not sure if they're feeling symptoms of a possible heart attack or a stroke coming on, what are some of the things to look out for so that they know where to go and how quickly they have to respond?
Right. Some of the hallmark symptoms of a heart attack, for example, are chest pressure, heaviness, tightness in the chest, associated with not feeling well. You typically feel short of breath or get nauseous, feel like you're going to throw up, or feel clammy or sweaty or sick. If you have symptoms like that, you just have to dial 911. Most people who die of a heart attack just have symptoms and suddenly have a big heart attack and immediately get into trouble. So you have to act on that right away. As far as stroke is concerned, if you have a sudden onset of slurred speech, or you notice a facial droop or weakness in the arm or leg or one side of the body, again, the only reasonable course is to call 911. There are some medicines now that we can give emergently to treat patients having a stroke, but they have to be given expeditiously, so it's important to get to the hospital fast. On the other hand, if you have a little upper respiratory infection, a little cough or a sniffle, but you're otherwise okay, you're not feeling like you're having trouble breathing, those things you can wait out or call your primary care doc or go to an urgent care to be evaluated.
Do you find that if people are coming to the emergency department for something like an upper respiratory infection or cold, or just a minor cut or some sort of low cut sprain, that it drains resources of doctors and nurses on duty, that especially if it's like a top cardiologist or a top doctor that is needed elsewhere, that they're spending time or in other parts of the emergency department tending to patients that could be going to an urgent care or a primary care doctor instead of the ER?
Well, certainly for minor stuff, you may be better served going to see your doc, or if you can't get an appointment with your physician, going to a clinic or an urgent care or a walk-in. But we're able to see anything, and we have the appropriate level of resources to manage things. And for lacerations that need suturing, for example, many primary care physicians don't have the resources in the office to do that. Broken ankles, emergent x-rays, orthopedic consults. So there's a lot of stuff that the primary care physicians just don't have the resources. They could do it, but they don't have the resource to do it. If somebody needs IV fluids, anti-nausea medicine, emergent blood work, you won't get that from your primary care doc. And in fact, if you call them and tell them that you're having chest pain, for example, they'll say, go to the ER.
What are some of the challenges that yourself or a medical team, your doctors, your nurses would face on a given day? Some of the things that they either have to consult you about, or you have to work with some doctors and nurses about any situation that arises?
Well, the most significant issue we have is when the ED is very, very busy. Occasionally, and this is a situation at every hospital across the country. If there's not enough capacity in the hospital, then admitted patients end up waiting in the emergency department, and that jams up the emergency department and may cause us to have patients in the waiting room. We never want to have patients in our waiting room, and if there's any available way to get the patients into the ED, into the ER, even if it's on a stretcher in the hallway, we want to get them in and get them treated.
When an ambulance arrives at the emergency department for whatever it is, if it's a heart attack or stroke, if it's a stabbing or a gunshot wound or something that needs immediate attention, how quickly do the responding doctors, nurses, anybody in the emergency department have to attend to that patient, make sure they get to the right room and into surgery if needed?
Well, right away. Very sick patients who are at risk get treated emergently, and that also may cause other less emergent patients to have to wait a little bit. But when somebody has significant trauma, they need to be diagnosed and probably or possibly get to the operating room if necessary within the first hour. There's a golden hour that you have to evaluate and diagnose and begin treatment. Patients who are having certain kinds of heart attacks have to go emergently to the cath lab to have the cardiac catheterization, which can diagnose and treat certain kinds of heart attacks. Patients who have acute strokes and are candidates to get thrombolytics or an interventional procedure have to have that diagnosis and treatment right away. So there's a time-sensitive component to the most serious injuries and illnesses in the emergency department.
What are some things that go on in the emergency department that you think most people may not realize? Some things maybe behind the scenes that you are working on with your staff?
Well, the whole process, people aren't familiar with it. They come in and we try very hard to do triage immediately and get patients into the ED and seen quickly, and then the ED physician will initiate whatever appropriate workup and treatment is appropriate in the given circumstance. And then we should communicate with our patients. There may be a period where the doc leaves the room for an hour or two while the patient is getting IV fluids and blood work and maybe an x-ray or a CAT scan. And it's really important that the patients know what the process is and what is getting done behind the scenes and what testing is planned and so that it's really important to convey that kind of information because people aren't familiar with what's going on in the emergency department.
Dr. Pulver, thanks for taking out some time today. I know things can get busy. I appreciate you taking out some time to explain what goes on in the ER and when people shouldn't be kind of coming here for treatment.
My pleasure.
That's Dr. Brad Pulver, Medical Director of the Emergency Department here at Ocean Medical Center in Brick Township. I'm Vin Ebenu for the Town Square News Network.